In Module 13, we'll be exploring the topic of psychological disorders. In this first video, I'll talk generally about what psychological disorders are and how we diagnose them. In the next 3 videos, I'll do a deeper dive into some specific psychological disorders, including mood disorders, anxiety disorders, and schizophrenia spectrum disorders. The APA defines a psychological disorder as a syndrome characterized by clinically significant disturbance in an individual's cognition, emotion regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. Psychological disorders are also sometimes referred to as mental health disorders or mental illnesses. I'll use these terms somewhat interchangeably in these videos. So what makes something be a disorder? If you feel sad for a few days after an ex dumps you, should you be diagnosed with depression? If you feel anxious before giving a speech, do you have social anxiety? Mental disorders have a few characteristics that distinguish them from the relatively normal emotions, cognitions, and behaviors that we all experience simply as a part of being human. First, disorders usually involve behaviors that are considered highly atypical and deviate from cultural expectations. For example, we all like to have clean hands, or at least I hope we do, but feeling absolutely compelled to wash your hands upwards of 40 times a day would not be considered normative behavior in most places. So the 2 examples I gave previously about being sad after a breakup and anxious before giving a talk would not in themselves necessarily qualify as a disorder because these are perfectly normal reactions that nearly everyone experiences in similar situations. Although, of course, if a person is excessively anxious and worried about the talk, beyond what would normally be expected for most people, or excessively depressed for an extended period of time after a breakup, this could be a potential indicator of a mental health problem. However, being abnormal in and of itself does not inherently make something be a disorder. For example, red hair is statistically uncommon. Only about 4% of the US population has red hair, but that's definitely not a disorder. Similarly, a person might engage in somewhat strange or atypical behavior, such as having an excessive amount of yard decorations, but that in and of itself wouldn't necessarily be a disorder. Instead, to be a mental health disorder, it must also cause the person significant distress and/or significantly impair their functioning in important life domains, such as work, school, or relationships. That is, the symptoms of the disorder must either be experienced as highly distressing to the person, such as experiencing excessively high levels of anxiety, or the symptoms of the disorder must get in the way of the person successfully meeting the demands of work, school, or other life obligations, such as a student whose anxiety is so overwhelming that they choose to fail a course rather than giving an oral presentation. Going back to my example with the excessive yard decor, if the person enjoys their yard decorations, it's not causing them any distress, and it's not getting in the way of their living their normal life, then it might be a somewhat odd behavioral quirk, but it's certainly not a psychological disorder. This requirement, that is, that the person experiences significant distress and/or functional impairment as a result of their symptoms, is included in the diagnostic criteria for every mental health disorder listed in the DSM, which we'll be talking about next. So how do trained psychologists make a mental health diagnosis? There are 2 common classification systems that are used by most mental health professionals. The first is the Diagnostic and Statistical Manual of Mental Disorders, abbreviated as the DSM, which is published by the American Psychiatric Association. It's currently on its 5th edition, so it's commonly referred to as the DSM-5. The other classification system is the International Classification of Diseases, or ICD, which is published by the World Health Organization and is currently in its 11th edition. For the most part, although there exist some minor differences, the disorders and their associated diagnostic criteria in both classification systems are largely overlapping. The DSM-5 is the most commonly used classification system among U.S. mental health professionals, so for our purposes, I'll be using the DSM-specified criteria when I talk about each psychological disorder in the remaining videos in this module. The main purpose of the DSM is to provide a shared language for clinicians and psychological researchers and to provide a standardized method of diagnosis. Imagine if each clinician had their own idea of what constituted depression or schizophrenia, for example. That would be really unhelpful and a little bit chaotic. Instead, the DSM provides a list of uniform criteria that all clinicians must use in order to make an official mental health diagnosis. For example, here is a DSM entry showing the criteria for schizophrenia, which we'll talk more about in the last video. As you can see, the entry provides a detailed checklist that the clinician can use to determine whether or not the patient meets the criteria for the disorder. This entry also exemplifies a few commonalities present in the criteria for all disorders in the DSM. First, for most disorders, symptoms must be present for at least a minimum period of time in order to qualify for a diagnosis. In this example, the person must be experiencing at least 2 of the symptoms listed in Section A for a significant portion of the time for at least 1 month. Second, recall that to qualify as a disorder, the symptoms must cause the person significant distress and/or functional impairment. So, every disorder in the DSM has language like what you see in Section B, which explicitly states that the person must either be experiencing significant levels of personal distress or significant problems at work, school, or in their relationships as a result of their symptoms. The DSM-5 includes a total of 279 disorders, grouped into several major categories, including mood disorders, anxiety disorders, neurodevelopmental disorders such as ADHD and autism, obsessive-compulsive and related disorders, substance use disorders, personality disorders, schizophrenia spectrum disorders, and many others. That's obviously way too many for us to cover in a single module, but in the next 3 videos, I'll try to give you a sampling of mood disorders, including depression and bipolar disorders, anxiety disorders, PTSD, and schizophrenia spectrum disorders. The DSM is not perfect, and with each new edition, researchers debate changes that should be made. For example, whether the criteria for diagnosing a particular disorder should be modified to some degree, or whether an entirely new disorder should be added. It should also be noted that it takes years of specialized training to learn how to use the DSM appropriately as a diagnostic tool. Psychological disorders are complex, and the same disorder can sometimes present very differently in different individuals. If you do not have postgraduate level training in clinical psychology, which I'm guessing none of you do, then you are not qualified to diagnose yourself or other people based on the information that you learn in the next few videos. So please don't. Though I will give a broad overview of several different disorders, there is much more nuance that is beyond the scope of this introductory level course. However, you don't need to be diagnosed with a psychological disorder in order to talk to someone. If you're feeling anxious, worried, or upset about work, school, or relationships in your life, you can certainly seek out a professional with whom to work through these issues. For your convenience, I've made a list of some free campus resources for you on the last slide in this PowerPoint deck. Another factor that can complicate an official diagnosis is that people can often present with more than one disorder at one time. This is called comorbidity. Comorbidity is common in individuals diagnosed with a mental health disorder. For example, having a primary mental health disorder increases the risk of developing a second disorder by anywhere from 2 to 48 times. This risk is also higher for related disorders. That is, certain disorders seem to kind of go together or co-occur much more frequently. For example, depression and anxiety have relatively high comorbidity rates. In one estimate, over 40% of people with major depression also had one or more anxiety disorders during this same time frame. From the anxiety perspective, the lifetime comorbidity with depression is estimated to range anywhere between 20% to possibly as high as 70%, with the highest comorbidity rates being for social anxiety disorder. What causes someone to develop a mental health disorder? As you can probably imagine, the root causes of mental health disorders are complex and multifaceted, with different disorders having slightly different etiologies or causes. And to be honest, for many disorders, we simply don't know exactly what causes them. Even when treatments are available, we don't always know exactly why or how they work. For example, one well-known theory of depression is that depressive symptoms might be caused by serotonin dysregulation, and we'll talk more about the relationship between serotonin and depression in the next video. And most current antidepressants, such as Prozac and Zoloft, treat the symptoms of depression by increasing serotonin activity. But some antidepressant medications, such as Wellbutrin, do not directly target serotonin at all, instead increasing the activity of 2 different neurotransmitters, norepinephrine and dopamine. And for very severe cases of depression that have been unresponsive to other treatments, electroshock therapy, which is much safer today than the movies make it out to be, is highly effective, with about 80% of patients showing substantial improvement, and we really don't have a good idea why. And of course, people can also recover from depressive episodes without taking medication at all. So although decreased serotonin activity is correlated with depressive symptoms, it may not be the only cause of depression or even a cause at all. Remember the reverse causality problem that we talked about way back in Module 2. However, even though the unique causes of specific disorders may not be fully understood, a more general model that is helpful to think about the onset of psychological disorders more broadly is the Diathesis-stress model. The Diathesis-stress model proposes that the onset of any mental illness is caused by a combination of diatheses, which are pre-existing tendencies or risk factors, and a triggering environmental event, such as a particularly stressful period at work or a change in relationships, such as going through a divorce or experiencing the death of a loved one. A helpful metaphor to think about the Diathesis-stress model is with these two cups. Imagine that once the cup is filled to the top, this represents the onset of a mental illness, such as depression. In this image, both person number 1 and person number 2 experienced the same amount of stress, shown in red. However, person 2 had a greater diathesis to start with. Perhaps they had a genetic predisposition that places them at higher risk of developing depression. This predisposition in and of itself was not enough to trigger the disorder on its own. However, because person 2 had a higher diathesis to start with, a moderate amount of stress was enough to fill the cup or trigger the onset of the disorder. We actually saw an example of the Diathesis-stress model earlier when we talked about gene by environment interactions. Do you remember this graph from Module 3.4? It showed that individuals with a specific mutation on their serotonin transporter gene, shown here in the blue line, were at higher risk of developing depression. But simply having this mutation was not enough to trigger the onset of depression on its own for most people. Rather, it was only when these individuals also experienced several stressful life events that they ended up going on to develop the disorder. In this video, I gave an overview of psychological disorders and how we diagnose them. For the exam, you should be able to define psychological disorder and discuss what characteristics are needed for something to qualify as a disorder, discuss generally how psychological disorders are diagnosed using the DSM-5 criteria, define comorbidity, and define and describe the Diathesis-stress model.